Hi, I'm Jim Edholm, and recently a group of business owners asked me to come speak to them about strategies that they might use in trying to reduce their healthcare costs. I gave them 5 very specific strategies, one of which is included in this short clip. Others will be posted shortly. So sit back, listen in, and see if maybe this tip will help you save money too. Thanks, enjoy it. You probably know that mass law, maybe you probably don't because this is really boring stuff, but mass law said to carriers a couple of years ago, you must offer a limited network product, one that restricts where employees can go. And that restricted network must be at least 12% cheaper than your broad network. First people to do this were Blue Cross, and I really marked them up because, candidly, we have the highest costs for healthcare in the United States, mostly because of partners. They're obscenely expensive, very good, but obscenely expensive. Not as good as most people think, but obscenely expensive. And they also have a lot of clout. Everybody wants to go to Mass General or Brigham and Women's, or Children's. So in the old days, when carriers were trying to negotiate tough with Blue Cross, with partners would say, hey, if you want to have a plan that doesn't include partners, that's up to you. And a carrier would cave because, of course, you don't want to have a plan that doesn't include partners, except for Blue Cross. They were the only 800-pound gorilla that could compete with the other 800-pound gorilla of partners. And so they said, yeah, I think we're willing to do that. So they came out with what they called their options network. And basically it's 3 tiers. And there's the best tier, the middle tier, and the lousy tier. It's based not on cost. It's based on quality and cost combined. So they're looking at quality outcomes. And if your doctor is in the best one, on this options plan, you're going to pay $15. If he is in the middle tier doctor, you're going to pay $25, and if he's in the worst tier doctor, i.e. if he's a partner's doctor, because their quality's good, but it's not enough better to justify the cost of what they charge, you're going to pay $50. So, hey, go wherever you want to go, folks. But you're going to pay more if you use a partner's doc. Same thing with hospitals. You go to Lowell General, and you're going to pay a $150 copay, no matter how long, you go in the hospital, you're there 5 days, it's going to cost you $150. You go to a mid-tier hospital, and I can't think of one off the top of my head, but if you go to one of those middle-tier hospitals, you're going to pay $150 after a $500 deductible. So now it's gone from $150 to $650. Well, take some thought. You go to one of the low-end hospitals, i.e. the partners, it's going to cost you a $1,000 copay after a $2,000 deductible. Take your choice, folks. Go where you want to go. You can pay $150 for the hospital, $650 for the hospital, or $3,000 for the hospital. And I'm not crazy about Blue Cross because it's like dealing with the government. They're pretty bureaucratic. But the point is that I marked them up for this because halfway through a 3-year contract, partners called them up and says, hey, let's renegotiate. Well, but golly, we still have 18 months left to go. Yeah, I know, but let's renegotiate. Long story short, they renegotiated the contract. Blue Cross's expected claims over the next 3 years are going down by $234 million. Tufts went down by a little over $100 million. I don't know what Harvard's was. I should know, but I don't. And it was all because Blue Cross was the only 800-pound gorilla that would arm wrestle with partners. So that's now led the legislature to say, okay, let's make every carrier offer another network. So every carrier now has a tiered network, and they limit the number of hospitals you can go to, and the prices must be at least 12% lower. So we got high-end plan. These are identical plans. And we got a low end. And there might be a mid-tier in there somewhere. But there is a 12% difference. Okay, what if you as an employer said, tell you what we're going to do, folks. We're going to have the plan one plan, one design, and we're going to let you pick which network you want to be in, but our share of the price is going to be 70% of this number. You want to go to the more exclusive hospital? You want to have access to partners and whoever it happens to be? Great, no problem. But you're going to pay the difference between this and that. It's all coming out of the employee. And that's fair. I mean, we're allowing people to pay for the choices that they want to have. So that's the second thing you can do.